Good afternoon, Ma. You can start now.
Good afternoon, everyone. Respected Dr. Fatima.S.BANO, MD Registrar, Pediatrics, Dr. Mehta's Multispeciality Hospital, Global Campus, the distinguished speaker for the day, Dr. S. Kodai, Principal, ETHIRAJ College for Women, Dr. D.B. Usharani, Vice Principal, Aided, Dr. T. Usha Priya, Vice Principal, Self-Supporting, Dr. T. Punitavati, Dean of Students, Aided, Dr. Anusha Balasingh, Dean of Students, Self-Supporting, faculty coordinators of ETHIRAJ, representatives, and the student participants. A very good afternoon and a warm welcome to you all to this webinar on understanding the variants of coronavirus. I now invite Mrs. M.R. Radhika, the faculty coordinator of the SWACHH ETHIRAJ League, to introduce the guest speaker of the day.
Good morning to one and all present here. It gives me an immense pleasure to welcome our distinguished speaker of today's webinar, Dr. Fatima.S.BANO, MD, Registrar, Pediatrics, Dr. Mehta's Multispeciality Hospital, Global Campus. I extend my warm welcome to respected Madam Principal, Dr. S. Kodai, Vice Principals, Dr. T.B. Usharani, Aided, and Dr. Usha Priya, Self-Supporting. I also extend my warm welcome to Dr. T. Punitavati, Dean of Students Aided, Dr. Anusha Balasingh, Dean of Students Self-Supporting, and League Faculty Coordinators. We are grateful to our college management for giving us the opportunity to organize this webinar. On behalf of the SWACHH ETHIRAJ League of ETHIRAJ, I would like to express our sincere gratitude to our esteemed speaker, Dr. Fatima.S.BANO, for accepting our invitation to address the students on the topic Understanding the Variants of Coronavirus. Dr. Fatima.S.BANO has completed her UG and PG from Madras Medical College and currently working as a pediatric registrar in Dr. Mehta's Multispeciality Hospital Global Campus. I welcome you all once again to this webinar and hope that you have a great time here. I request our distinguished speaker, Dr. Fatima.S.BANO, to take over the session. Thank you.
Thank you for the warm welcome. And I think we'll begin our presentation. It's going to be a very short presentation. And hopefully by the end of this presentation, we would have learned a few important things that will help us with the ongoing pandemic. So the significance of COVID variants. With this presentation, I would like to highlight what variants are and why do they occur. And we have heard of these terminologies, variant of interest and variant of concern. And what do they mean? And what are the major variants that we have come across till now? And if there are any difference in symptoms? And what would be the way forward? And if vaccinations are going to be helpful or not? Am I audible?
Yes, ma'am, you're
Yes,
audible.
ma'am. Yes, ma'am.
So now what are variants? So viruses, like all organisms, are going to reproduce. And these viruses are RNA based. So what happens is we are DNA based organisms. So when these organisms reproduce, there is no proofreading. There is no mechanism in check. So when they reproduce, it's like trying to take a photocopy with an old Xerox machine. So here and there, every time there are going to be certain changes. So with rapid multiplication, these changes are going to accumulate over time. And as these viruses evolve, they are going to keep those accumulations that are going to give them a survival advantage. Say, if any particular change, so as we can see, there are various spike proteins. So these are your spike proteins. So with the multiplication, if there is a variation that is going to give it an advantage, like if it gives its protection from an antibody, then this particular mutation is going to be kept by the virus. So this is part of your natural protection, natural selection mechanism. So what is this? How is this going to affect the pandemic? So what happens is, say this particular strain is seen in a particular region, in a particular country, then what happens is, as the people who have been infected with this virus are going to migrate or travel to another country, this virus is going to spread there and become the dominant strain over there. So this is how we are seeing all these variants of interests and variants of concern. So these terminologies or these labels are actually given by the World Health Organization. And when do they label a particular variant as that of interest? So either there should be an increased transmission, that is, it would be easier for the virus to spread from one individual to another, or it is causing increased disease severity. So now this particular variant Omicron, they say, is a milder disease. Say if there is a particular variant which is going to cause a more severe disease, then that will become a variant of interest again. Or if we are not able to detect it with the current means, if we are not able to detect the disease with the currently available RT-PCR, then again it will become a variant of interest. And the other thing is, if this particular variant is occurring in some remote island somewhere and it is not going to cause any community transmission, it is not going to spread anywhere, it is not of particular interest. So basically, any variation or any mutation that is going to be a significant risk to global public health will be a variant of interest. Now, this variant of interest will get promoted to variant of concern when all of these points that I said previously are actually happening. So you can see that the transmission has increased. With this Omicron, there is an increased transmission. The incubation period has shortened and people are getting infected very quickly. So it has become a variant of concern. And the effectiveness of public health measures are not, it has come down. Say, for example, earlier they said that cloth masks were sufficient. But then the CDC again revised their guidelines saying, no, you have to wear a double mask. So the current public health measures, when they are no longer effective in controlling this virus, then again it becomes a variant of concern. And the other terminology is variants under monitoring. So there are so many variants under monitoring. The reason why I put in this slide is every time on the news, whenever they say, so there's a new variant, there's a new variant, it doesn't mean that we have to panic. Okay, this virus is going to keep coming to us in various forms, like how Kamal sir came in his movie. So it doesn't mean you should panic. You should just keep calm, and we should. Now the end point of this pandemic is not eradication. It is not going to be possible for us to bring the case numbers completely down to zero. The endpoint will be endemicity. That is, it is going to become part of our infectious disease pool of organisms, say like tuberculosis or say typhoid, like that. So how are we going to do that is we have to define a new normal. So as I said, it is not possible to bring it down to zero. So we'll have a realistic number which will not overwhelm the healthcare system. With the hospitals that we have, we can manage a certain number of cases a day. So if the viral load is going to be within that, the healthcare system will not be overwhelmed. There will not be so many deaths. So we should have a realistic target and we should keep tracking the progress. See, a lot of us are very hesitant when we get infected or when we have symptoms to go and to get ourselves tested. The reason why this is detrimental to the entire society or a population is that if there is any new variant, or if there are any changes in the way the disease is presenting, the researchers or the scientists are not going to be aware of it because you're not going to go get tested, you're not going to give your sample. We will not be able to sequence the gene of the organism that has affected you. So there is a possibility of missing out variants. So the most important thing, see, now Omicron came in South Africa. The researchers there, they were very diligent and they sequenced the entire genome and they gave it to the world so that we could find out easily who is being affected by Omicron. This is going to help not only in diagnosis but also in finding the new medications. So when we find medications, it has to be specific to the gene, it has to be targeted. So only if we know what are the variations present, we'll be able to find targeted medication. So even for this reason, I would suggest that get tested whenever you have symptoms. This is like the small thing that we can do as an individual. And the other thing is we have to limit serious illness. So how are you going to do that? As I said, with newer medications, and we have to strengthen our healthcare system. That is not done at an individual level. It is more of a government agency's task. What we can do as individual is that we can get vaccinated, encourage vaccinations, and as individuals we can slow down the transmission. So test yourself, have safe interactions, At some point of time, if you're able to go to college in an offline manner, try to maintain social distancing. And as long as you're inside the classroom, continue to wear masks. And the other thing, the infrastructure improvement is we can use HEPA filters. So all of these things are going to become the new normal. This is how we are going to control the epidemic. We're not going to eradicate it. It is not, it is in the near future, it doesn't seem to be possible. So coming to Omicron as such, why is it different? It is because it is more easily transmissible and it has a very, very short incubation period. The symptoms are mild, but only for those who have a very good, robust immune system, like young people who have been vaccinated. But for older people who have other comorbid conditions, it's still causing a severe disease. And the other thing with Omicron is that there is a chance of getting reinfected. So if you get COVID once, it doesn't mean that you will not get COVID. There is a high chance of of you getting the reinfection again. Why I put in this slide is because I want you to see this is the disease peak in South Africa. So this particular line is of the fourth wave. So there was a sharp peak. This is because very short incubation period and doubling time is only 1.5 days. So within 3 days, you will start getting your symptoms. And the symptoms are very much similar to flu. So you can see in Omicron, you will have cough, sore throat, fever. There will be this generalized body aches, tiredness, headache. The other thing that I want to highlight is there are some new symptoms that patients are presenting with. That is, they're having chills and shivering, and night sweats, and also burning eyes and redness of eyes. And the other thing is, earlier they used to say that there will be this loss of taste and loss of smell. But now with this Omicron variant, this loss of taste and smell is not that very prominent. So if you're having flu symptoms, but you're not having loss of taste and smell, it is not actually reassuring to think that, okay, this is not COVID, it's a normal flu. It could be the Omicron variant also. So when you have these symptoms, we are going to suspect and we are going to do the testing. And once the testing is done, then if you're negative, it doesn't mean that you don't have the virus. It is still possible that you have the virus. So you'll have to continue to be under observation and you will have to isolate yourself. If you're positive and you're having only mild symptoms, then again, we are going to go in for home isolation as long as you're a young, healthy individual. So for home isolation, the basic thing is that you need to have a separate bedroom with a separate bathroom. Otherwise, you will have to keep disinfecting the bathroom after every use, and you need to have separate vessels, and you need to have a pulse oximeter and a thermometer. And there should be somebody who's, so if you're living individually in a house separately, it is not really advisable because you have to have a caretaker who is there with you 24 hours. So in case you develop some worsening of symptoms, they should be able to take you to the nearby medical facility and at least have an online consultation with a physician every day, check in with them, tell them what your symptoms are. And if whenever that caretaker is going to come and interact with you, especially for this variant, they will have to wear a medical grade mask whenever they are present. So a cloth mask is not going to be very effective. A medical grade mask will be ideal. N95 mask would be ideal actually. And the other thing is, please don't make children wear masks if they are under 2 years of age. It is not at all advisable. Only those who are 2 years of age who don't have any other issues like say you'll a wheezing child or any child with breathing difficulty, please don't make them wear a mask. And so when should you be worried? When you're under home isolation, you have to keep checking your saturation. Whenever the saturation falls to less than 94, or you're having difficulty in breathing, or there is a pain in the chest, along with some confusion, or you keep feeling drowsy, or it's been 3 to 4 days since you've tested, but your symptoms are the same, you're not at all feeling better, or you're feeling worse, that is when you have to immediately go to the hospital. And the other thing that I want to highlight is we see a lot of memes with the pulse oximeter being fixed on a potato or on a pillow and still showing reading. See, it's a machine and it's just going to it's going to pass the infrared rays and take the reading. So it doesn't really know whether it is a finger or whatever it is. There are certain precautions that you have to take before using a pulse oximeter. So you have to remove your nail polish. This is very important. If you check it with your nail polish, you're going to get wrong readings. And warm your hands. Cold fingers, the blood flow will be very less. So again, you'll get false readings. And sit down for 5 minutes. Don't do your yoga and your exercise and then immediately check your pulse ox. No. Rest for 5 minutes and keep your hand at the chest level like this. And then You fix the pulse ox and keep it there for at least 1 minute. Let the reading stabilize, and then you take the reading. And this one is for prevention. So see, basically the spread can either happen through aerosol or through droplets. So aerosols are these small tiny particles that you can see. So they will be less than 5 microns, and they will very easily, they will be suspended in the air itself. So even if this infected person has been in that room and left, there is still a possibility of you getting infected, which is why you're asked to wear a mask. The droplets are slightly heavier, so they will fall to the ground immediately. So that is why you have to take these contact precautions. You keep disinfecting the areas which have been touched frequently. And another important thing is, since the beginning of the pandemic, a lot of people come to me and they say, since the beginning, we have been doing steam inhalation, we keep gargling, we use salt water, we only drink warm water. See, all of this is fine. But the thing is, it gives a false sense of security. See, this is not going to prevent the disease in any way. It is only going to give you symptomatic relief. If you are going to have a common cold, it will obviously, if you're going to take steam inhalation, the congestion is going to come down. But this is not going to prevent COVID, or the warm water is not going to go inside your nasopharynx and clear the virus from there. So you can do this, yes, but you have to take actual precautions such as vaccination, social distancing, and everything else that is prescribed. And the other thing is, yeah, hand washing. Wash your hands for at least 40 seconds. There have been so many videos, showing you exactly how to wash the hands, and use an alcohol-based sanitizer. All these fragrance-based herbal sanitizers are not very effective. And we've been taught that you should share. But now in this scenario, there is no need to share. Please use your things yourself. Don't share it with anyone. And surface disinfection, you don't have to purchase all these fancy aerosol sprays. There is no need to spend on all that. Just use 1% hypochlorite or bleach and disinfect all the surfaces. And discarding masks, of course, for the previous waves, we would have seen a lot of pictures, and people have collected used masks and repackaged it and sold it. So the thing is, cut your mask into two and put it in a plastic bag and just keep it for 72 hours, so that all the virus particles, they get, they get destroyed, so that you don't spread infection through your mask itself, and then you can discard it. There have been new guidelines from the government wherein for this variant, total number of days of isolation have been reduced. So 7 days of isolation or 7 days from date of testing positive is sufficient. You should have been afebrile for at least 3 days. And after 7 days, there is no need for you to do an RT-PCR again and check if you've become negative. 7 days have passed, you can go back to work, go back to college. And the other thing is, say someone in your family has become positive, but you are asymptomatic. You needn't get yourself tested. There is a high possibility that it is going to be COVID only. You needn't get tested, but you have to isolate yourself for that, for those total number of days. Okay, so take the precaution. And now to talk about vaccines, just a small video to actually explain how this immunity works. So what happens is, the virus comes in and it will attach to the cell and it will send in this mRNA. So once the mRNA enters the cell, we can see that the cell has become infected. So once the cell has become infected, it is going to produce a lot of virus particles. So what happens when these virus multiply within the cell? This is our immune cells. So the immune cell gets alerted. But it is going to take some time for the cell to produce an antibody. An antibody is what is going to kill the cell. But by the time the antibodies are produced, this virus has been replicating rapidly. And this is going to cause symptoms. So you're going to get fever, myalgia, and all of that. And after getting those symptoms, then the antibody is going to be produced, and then the virus is going to get destroyed. So the immune system will kill the virus. But the thing is, it will be slow to attack. And this will be a problem, especially in older people or people whose immune system has been weakened, or people with other comorbid conditions. So for that reason, what we do is, it's like revising for any exam. Say if you have an exam and you haven't studied, or you haven't studied as much, you will still be able to do some, you will be able to write the answers, you will be able to get a certain mark. But other way, if you have a blueprint, okay, and if in that blueprint important questions and everything, so immediately, as soon as you see the question, immediately you know the answer, immediately you're going to write, you will have sufficient amount of time. So the same thing with the virus and immunity also. So this is the blueprint. With the vaccine, you're going to give it a blueprint. So the body knows, okay, so this is the virus, this is what I have to attack. As soon as the virus enters the body, I'm going to immediately attack. So as you can see, the spike protein is being taken, the mRNA from that, and then they are going to put it in a virus. They're going to put it in a vaccine. And this vaccine, once it enters the body, it is going to build its own spike. So the body is going to create its own spike protein. So there'll be multiple copies of the spike protein. So now what happens is this immune cell is going to come. It is going to see that so many spike proteins are there. It is not part of the body. I have to destroy it. So it is going to destroy all of these spike proteins. And it will also destroy that mRNA. At the end of this whole process, what will be left is a B cell. What is a B cell? A B cell is a memory cell. So it is going to remember. So as you have read for the exam and you've remembered what you have read, similarly, this B cell is going to remember the blueprint, okay, this question. So if this virus comes, I have to release this antibody, and this is how I'm going to kill the virus. So this is why we are encouraging vaccinations, because it is faster to develop immunity, and it will be helpful, especially for those who are immunocompromised. But the thing is, like all immune mechanisms, if you're going to give a vaccine, there will be some side effects. So basically, you're introducing a foreign object into your body. So if any foreign object is going to come in, the body is going to react to it. So there will be some mild fever. There will be some amount of body pain, some headache. Each person is going to react separately. But this should not be a cause of fear. It is definitely going to help in the long run. And so the other thing that I want to talk about is the booster dose. So, okay, you've studied for the exam, you have like 5 papers, so you've read for 5 papers. Now you've come to the exam date, you're able to revise only for 2 papers. Third paper, there's no time, you've revised only 5 chapters. But at some point of time in life, you've read the 10 chapters which are there for the exam. But when you're seeing the question, you're not able to remember from those chapters which you have not revised. So it is a similar mechanism for immunity also. So yeah, you have given vaccine, but now it's been so long since the vaccine has been given that the body has forgotten. So you need to give a booster dose, and you have to refresh the memory. There'll be a lot of papers and a lot of scientific discussion regarding vaccine effectiveness, saying this vaccine is effective 80%, this vaccine is 88, this vaccine is 70. See, what we have to understand is 70 or 80 or 88, whatever it is more than zero. It is more than having no immunity at all. So if anybody here has the opportunity to go to the US and get Moderna booster, that is great, good for you. But if that is not possible, then when the government allows the booster for everyone here, then I would suggest please go get a booster dose. It will be good to build up your immunity, and you will be able to battle this coronavirus. And to finish the talk, I want to highlight this word equity. So a lot of people, you would have heard this definitely, you're students of humanities. So the thing is, none of us are going to be safe until everyone is safe. So this Omicron actually arose in South Africa. So a lot of immunocompromised people who didn't have access to vaccines. There are around 44% of the people who still don't have access to vaccines. So what happens is this virus is able to freely replicate within the body for a prolonged period of time. And during that period of replication, a lot of mutation is happening. So this is how you're getting the variants. So if you're going to stop, if you want to put an end to this, you can do this by encouraging vaccination and making sure that everybody is getting vaccinated. So you, as pillars of the nation, you are the future of tomorrow. So you have to encourage vaccination. You have to tell your parents, your neighbors, whoever is ready to listen to you, get vaccinated, tell your friends. And the other very, very important thing is there is an infodemic. So you have a lot of information. You don't know which information is true. You don't know whom to follow. So all of this confusion is there. So if you are going to see some misinformation, you feel it as misinformation, don't engage with it. Don't, on a public forum on Facebook itself, you don't have to reply to them publicly. You just report it as misinformation, and you can send them a private message or send them a DM and just say, see, this is misinformation. Please don't forward it. Everybody likes to see a fight. So if you're going to have this comments back and forth, everybody is going to come see. You're only going to propagate it. So just don't participate in it, don't spread it, don't engage. And if God forbid any of us is affected, then please break the chain, isolate yourself. So thank you for the time that you've given me. Thank you for the patient listening. Stay safe.
Thank you, Doctor, for enlightening us with inputs on variants of coronavirus. I now welcome a few questions from the students.
Ma'am, is there any possibilities that we can get rid of this pandemic?
No, as I said, it is difficult to get rid of it. It is going to become an endemic. So it will be like at some point of time in the future, it will be like any of our other viral illnesses. It will be like dengue or, typhoid. It will become like that. It will be part of our infectious organism pool. We'll not be able to get rid of it, I think.
Okay, thank you, ma'am.
Anyone else? Any other questions? Okay. Thank you, Doctor, for patiently taking time to answer all our questions. I deem it a
Thank
great
you.
honor. I deem it a great honor and privilege to propose the vote of thanks for today's webinar on understanding the variants of coronavirus. On behalf of SWACHH ETHIRAJ League of ETHISHAKTI 2021 to 2022, I would like to thank our distinguished speaker, Dr. Fatima.S.BANO, for her excellent presentation and for making this webinar interesting and informative. Thank you, Doctor. I'm sure her words of wisdom and excellent coverage of the topic has helped all the participants to gain more knowledge on understanding the variants of coronavirus, especially in the challenging times. I wish to express my sincere gratitude to our respected chairperson, Ms. Chandra Devi Tanikachalam, and the Board of Trustees for the constant support and motivation. I wish to express my gratitude to our respected Madam Principal, Dr. S. Kodai, ETHIRAJ College for Women, Dr. D.B. Usharani, Vice Principal Aided, Dr. T. Usha Priya, Vice Principal Self-Supporting, for their constant support and encouragement in all our efforts. I'm extremely grateful to Dr. T. Punitavati, Dean of Students Aided, Dr. Anusha Balasingh, Dean of Students Self-Supporting, for their valuable guidance, encouragement, and moral support. I also extend my special thanks to all my league faculty coordinators for their valuable suggestion and unstinted support. Last but not the least, I thank all the student representatives and participants for evincing interest in making this webinar a resounding success. Thank you and have a great day.
Thank you, madam. Thank you, Aishwarya.
Thank you, ma'am.
Thank you, ma'am, for spending your valuable time with us, ma'am. Thank you so much, ma'am.
Thank you.
Thank you.